The first talk that I gave you indicated that this instrument is able to align energy with a blood spot placed in the well on the machine. And when the energy is tuned in to the energy of the blood spot, we then can obtain a radionic diagnosis, and thereafter we can treat on that diagnosis. So obviously we have to have a starting point in which all the patient's body parts, let's just see where we are. There's the patient, there's his blood spot, which can be placed in the machine, or some representation of him can be placed in the machine, and the machine itself, generating energy fields, must align itself with the blood spot in order to treat the patient. And if the machine is to diagnose the patient, it has to diagnose its anatomy, but not its actual anatomy, but the pre-physical state of the anatomy. By that we mean that an organ or a part of the body is in a process of dynamic change. It is being reconstituted, and it is being broken down continuously. As I sit here, I'm wearing my elbows out. The tissue on my elbows, the skin on the elbows must be replaced. And this is so for all the organs of the body. We say that before the tissue will multiply on the elbow, pre-physical matrices must be created, energy fields must be created, in which the cells will grow that will replace the worn out cells on my elbow. So let's be quite clear right at the beginning that the radionic diagnosis is of the pre-physical structures which are about to become physical. Where you have a chronic disorder like rheumatoid arthritis or a cancer developing, then the diagnosis is in terms of the etheric or pre-physical forces feeding the cancer. And this is what is diagnosed, and this is what is treated. And so it's erroneous to say that you can diagnose rheumatoid arthritis with a radionic instrument. You can't. What you can diagnose is the pre-physical forces and their qualities, which in most instances lead on or present physically as rheumatoid arthritis. It's not a device for getting out of things, it just is that. You must understand we are diagnosing not the blood spot itself, but the radionic energies, or if you like, the pre-physical energies associated with the blood spot. Because we are diagnosing body parts and their disorders, we obviously have to have a starting point in anatomy. And so just about every part of the body is elaborated and is mentioned and is given a radionic rate. If, for instance, we take the duodenum, then the peritoneal covering of the duodenum, nice if I had a pupil who would see my blackboard. There's the duodenum. The peritoneal covering, which attaches the duodenum to the abdominal wall, there it is there, the peritoneal covering, has a rate of 8101. Then you have the muscular coat of the duodenum, you have the blood vessels of the duodenum, you have the lymphatic vessels, you have the goblet cells, you should have, but probably haven't got, the deep glands known as the succus entericus, and so on. Everything to do with the duodenum is on there with an appropriate radionic rate. And part of the equipment, therefore, is to have a series of anatomical sheets called location sheets. Location sheets. And each sheet that is mentioned, like the duodenum, is given on the opening index, as it were. And the duodenum is there. And so these refer to the sheets here, which are in detail. So that covers the anatomy of the human being. And its pre-physical rates, its pre-physical entities. The other thing is that you are interested in symptoms. Pain in the duodenum, or pain in the duodenal area, or we could say cold in the head. I've got a cold in the head. It's not meant to refer to a disease, which is an upper respiratory tract infection. What we're saying is that I feel, oh my God, I feel awful, and that is a cold in the head. Now, again, that is the characteristic attitude, the approach in esoteric healing is to treat the patient, and you treat the patient by noting the symptoms. And so we have what we call a set of symptom factors involved. The other thing that we have to deal with is the causes of the condition. If I can set up this instrument for a symptom, where there is diarrhea, for instance, the person is suffering from diarrhea, we've got his blood spot, and we set it up for diarrhea, and the diarrhea affects the small intestine, enteritis. We put that on here. Then we may be able to go to a cause sheet and find the cause of the diarrhea. And I might then be able to place the cause sheet in the instrument and put a detector on it and go down and see if the cause of the diarrhea is aspirin. The fact the person's taking aspirins may be causing it. Or maybe it has something to do with the food that he's eating. Anything that is poisonous or toxic is on the toxic list. And so we've got a list of all the toxins. And you can be pretty well sure that no matter what condition exists, there is a toxic factor involved. There's always a toxic factor involved. So this would be one sheet that you would always use, and of course it goes to quite a few things. There's 2 pages of toxic substances which could be involved. Things like ptomaine from eating food out of a tin, to quinine, the effects, the iatrogenic effects of a quinine dose, and so on. So there is supplied a radionic set of rates which are used pretty extensively. Now, just let me explain something of the mechanism involved here. This is known as a cursor bar. It's a cursor bar. It can be screwed tight or it can be quite loose. And the idea is that in your initial location, person's got pain in the right shoulder, pain in the right shoulder blade. So you set up pain in the right shoulder blade in rates on these dials from the sheets that you've got. And now you want to find out where the cause of the condition lies. What has caused the condition? And where the site of that cause is. What system of the body is involved? Is it a nervous condition? Has he got a fibrositis causing the pain in the shoulder blade? Is it because there is a blocked artery there? Is it rheumatism caused by a virus? Is it a cancer developing? What is it? Perhaps it's metabolic. And so with the cursor bar, we can go through a range of things. Now, it so happens that I occasionally get a pain in the right shoulder blade, and I'm taking part of myself, which is a ring that I've worn many, many years. I'm going to put it in the well. I'm going to switch on the machine. It's quite easy. The first thing that I'm going to do, pity I'm using that, but the first thing I'm going to do is now to let my fingers slide over this stick pad. I'm going to turn all these devices to naught, all these. I must tell you that these, I have to use my own methods. The Delaware method would vary slightly, or to some degree, and in the end, everybody finds his own methods. That is the existential nature of the machine. Once you have learned the basic principle, you find your own methods, which obviously are meant to save you time. And just for instance, I would now tune the instrument via this magnet that is lying there. I'm going to tune the instrument in to the representation of me. And when that stick occurs, and I'm going round till it does occur, then I will be tuned in the moment it does. There we have got it now, right now. That well has been used. You may use that one. Sometimes one works better than the other. I've forgotten the rationale for it. This machine is now oriented to me. The next thing I would do is to set up the symptom, and that is pain in the right shoulder. That's how the patient would come to you. Oh, I've got pain in the right shoulder. It comes suddenly on after a meal. I don't know what it is. So you'd set up that on here. For me, I'm going to use my own device, which is not to look for a rate, but I'm going to visualize the condition, and I'm going to set it up. I'm going to set it up on this, first of all, the symptom, and I'm going to visualize the pain, and then I'm going to visualize the kind of pain. Now I'm going to visualize the shoulder, the scapula, beneath the scapula. I can do this because I've done the anatomy of it all. But you could equally go to the rate book. You could find better spots than that one. Always 2 or 3. I've taken the first ones for the sake of time. This dial at the bottom here tells you how severe the pain is, and you should make a note of it. It's 0 to 100%. Obviously, I've already passed the stick. I've got no pain as such today. If it is, it's unclinical. I can't feel it, but there was a stick almost immediately. So it's about 8%, and I'm going to leave it like that. The advantage of this is that if you start off and you assess that the pain is 80% and you give the treatment and the pain drops to 40%, you know the pain is the treatment is being effective. I keep doing this because I've used chalk on my hands, unfortunately, and that's the worst thing you can have on your fingers when you're using a thick pad. Now I'm going to go down through the locations. And the thing is to keep your mind now only concerned with the systems that are enumerated on this list. And the first one is, in other words, is this that I've set up for, is it concerned with the mouth, nose and throat? Is it concerned with the sinuses? Is it concerned with the stomach? Is it concerned with the duodenum? The small intestine? The large intestine? The pancreas? The gallbladder and bile duct? The liver a little bit, spleen and thymus, lymphatic slightly, ductless glands, and so on, nervous system, urinary tract, male genital tract, breasts. Most of these are clicking very, very slightly. In fact, this is a gallbladder and bile duct pain, and the gallbladder does reflect its pain to the right shoulder blade. And so we would then be able to look through our location sheets very quickly, and we would say, right, gallbladder and bile duct, sheet G, gallbladder and bile duct. Right over there, take it out. I'll put it on here, the thing for slipping it in. The mucus coat, sphincter, arteries, cystic arteries, lymph vessels, nerve, celiac plexus, right phrenic fibers, hepatic plexus, the biliary duct, bile duct, bile duct, bile duct. See? It doesn't do it on duct, it does it on bile. It's just as the thought comes into the mind. Click. Now, if you've got a mind that is wandering over everything under the sun and you're thinking about a car coming up the road, you're no good for this. On the other hand, if you have a mind that is rigid, sticks entirely and wants to get the result from this, your mind wants, you're no good at it. The gentle middle path. Now, in the last 5 years, I have grown, developed something there that flashes. It gives me a light flash. I've described it in my lectures before. That is exactly the same functioning thing as this. Now, that doesn't mean to say that I get that every time the moment this clicks. But I will occasionally get this flash occurring just before I'm coming to a system or a part that is relevant. And so somewhere further back here, gallbladder, serous coat, fibromuscular coat, mucus coat, there was something there. There's a very, very, very slight thing there. So you write that down. I'm not going to go any further with that particular thing, but that is how you tend to locate. Set up your symptoms, tune the machine in, go through your sheets, find where your locations are, and then you can set up. Right, I could now set up the serous coat of the gallbladder. I could now set the serous coat of the gallbladder up, leave the pain as it is, and we will say that we will put down here 3, 3, 5. serous coat of the gallbladder. And now I'm going to say, well, cause. I want a cause sheet. I want a cause sheet. So I will go over here, take the cause sheet, put it in. Now let's see. Is this a virus infection? Is it a bacteria infection? It's a very faint then. Bacteria infection. Yeah. Poison. Okay. Allergy. Toxins. Secretion imbalance. Hormonal. Mineral. Vitamin. Psychological condition. Nothing there at all. So, I must go over it again now using my own consideration. I know what causes it. Is it a fibrosis? A fibrositis? Is it a tumorous condition? Is it a carcinomatous condition? Is it a metabolic condition? Something there. Is it a metabolic condition? Is it a metabolic condition? Something very faint there. Let's therefore go into the metabolic and take it a little more analytically. Is it protein diet? Is it fat diet? Is it fat diet? Is it fat diet? Is it protein? Fat? Carbohydrate? Fatty food. Fatty food. Straight away, being a doctor, I know that fatty food causes the secretion of a hormone from the gastric mucosa, which causes the contraction of the gallbladder 5 hours later, and if the gallbladder is hypersensitive or if it's fibrosed or something like that, then the contraction will produce a pain, and the pain will be referred to. And so, this is the sort of thing that one does. You have to learn the machine yourself. Once you have got your reading here, you have got the symptom, which is pain in the shoulder blade, and you have then analyzed it, and you have found that it's the fatty diet, or the effects of fatty diet, or it is the mucus lining of the gallbladder, or whatever it is. Then you can set up a complementary rate to it. For instance, if you left this machine exactly as it is, which is pain in the right shoulder, and you left your blood spot in there, and you left it overnight, this would be radiating to you qualities aggravating the pain in the right shoulder. This has been observed by me and others, that when you leave the machine by mistake in the diagnosed condition, you are radiating that condition to the patient. And so it follows that if you put a complementary on the machine, then you are treating him. So what you do is to go to the rates. Say it was 24.683, and the organ was 69215. You take that away from 5 from 10 is 5, 1 from 10 is 9, 2 from 10 is 8, 9 from 10 is 1, 6 from 10 is 4, 3 from 10 is 7, 2, 4, 6, 8. And that's what you would set up your treatment dial. 86, 44.
It'd be 76, wouldn't it be?
What?
It'd be 76, wouldn't it be?
No, you must forget that. You must take them each away from 10.
You don't carry like regular
No, no
subtraction.
carry.
Okay.
No carry. 86.42, 427, and so on the dial. And that is actually treating. That is actually treating.
With the same machine.
With the same machine, or you can get transmitters, little boxes, transmitters, and these you can set up. You can have 30 or 40 blood spots, and you go around during the day, and you end up with about 4 of these, which is for the different symptoms. You treat the different symptoms. When you're diagnosing, you end up with 4 of these, or you take the top 4, and you alter your transmitter to the different rates that you have located in your diagnosis. Yeah.
Now, this is what they were doing at Stone
Yeah.
with all the, as they were going along.
Yeah.
The medication sitting on the top of
Yeah.
each one. I don't understand.
In other words, when the blood spot comes in, the first thing that happens is that Corte, or the diagnostician, does a test like I've done. He writes a report which goes to the patient, and the price of the treatment is quoted. The patient then writes back and says, yes, put me on treatment, here's my check. They then write out a card saying what the treatment should be, usually 4 or 5 of these, and then an operator goes round and alters the treatments so that each of those is done. And technically, I don't know what the arrangements are, it should be done for 24 hours a day.
Every 6 hours.
Changed everything but for 24 hours a day. The what? Treating the patient's blood spots.
So each one of those 4 numbers, they link those to a treatment substance, like citric salt or...
No.
Well, why do they have the homeopathic remedies on top of the metal plate on the...
What they might have is they might decide that you can treat just purely radionically, or you might find that you say what shall we treat with? You may have a whole set of remedies. You may say, well, shall we treat with penicillin? Penicillin is suitable for this. Shall we treat with sodium chloride, magnesium phosphate, calcium phosphate?
So they set that thing on top of the machine so they're treating them.
Or you can place the material in such a place on the instrument that it radiates the radionic rate for that bottle. There are thousands of variations. You can do anything.
They had a metal plate.
Yes. Yes, that's right. This is the whole thing with the machine, is that you can adapt it to almost anything. But of course, in the end, you almost can do it yourself without the machine. Yes.
You're saying, in other words, that this can be done by telepathy, by mind, after the diagnosis has been given?
Now you mustn't mix the two. If you're going to use telepathy, then you must just lies the patient whole. leave the machine out, don't mix the treatments up.
But the diagnosis, once you have diagnosed the patient...
Why do you have to diagnose if you're going to use it telepathically? It's like mixing two systems up. If you're going to use telepathy, just visualize the patient whole. Now, what I should say is that Delaware died before the research could link up the use of magnetism for treatment with radionics. But that doesn't mean to say nothing was done about it. It was done. And when you can obtain a radionic diagnosis, you can then use the magnetic solenoids to treat it. And if you had a radionic instrument with 8 solenoids, you could have a blood spot attached to each solenoid, or just put the blood spots down and lay the solenoids on top. And you could, of course, you'd have to do an analysis first, and you could then treat. You could then treat with magnetic impulses the blood spot, being more specific. If there was arteriosclerosis, or if there was coronary, post-coronary condition, or high blood pressure, or low clotting rate, then the mixed frequencies of the MT3 tape could be applied to the blood spot. And you would be irradiating the blood spot with adjusting frequencies for lowering cholesterol, for moderating the blood pressure, and so on and so on and so on. Or you could have one of the solenoids, which are large, and you could put your blood spots inside the magnetic field. Now there's a whole field of investigation there. I was involved in that, and I went much further than that. And this is the sort of line of investigation that we were engaged on. And I don't know if we have located this device in the clinic room yet, but we packed it away. And so if you could take a mannequin, a picture of an anatomical picture of a human being, classical one like we have printed somewhere, and you could cover it with cellophane in which the person's saliva has been smeared, the blood which has been citrated to stop it clotting is over the whole thing. You then have an image of the patient. It might then be possible to apply stimulatory factors to this image of the patient. So we use the Graaf machine. The Graaf machine, which produced voltage of 500 million volts with very little amperage. And it was possible to move the screen around so that voltage discharges could be made to the mannequin. In fact, we abandoned the mannequin after a while and just had accurate anatomical drawings. And if there was stroke, for instance, and the stroke was located to a particular part of the fissure on the brain connected with movement, then you could apply the stimulus to that particular area. Now that is way, way up and needs further investigating. Way up. The alternative is, and this is still to be investigated, that you could have a large mannequin, and that it would be possible, by the same process of the blood sheet over it, to place miniature solenoids in their appropriate position for lowering blood cholesterol or whatever it is. Very exciting indeed. All lies in the future, and as we get set up, we can go into that. It's the sort of thing that make Delaware go. The thought of instrumentation, the ideas of having the anatomical figure and acetate sheets that could be slid in for each patient. Way up.
I got Margaret Delaware, which is number 29. She's in there.
Yes, she has her attitudes, and she obviously can't initiate this sort of thing. But it's a field that we could quite easily.
What type of mind does Marjorie have? She seems to display already physical characteristics of confidence.
That's right.
Mind.
I think it's a fifth grade mind, and that could be personality.
Are there advantages in having a person there instead of blood spots?
Oh,
What advantages would there be in that?
well, the advantages are that the person is dynamic. He is presenting, wherever you place the solenoid on the body, he is presenting a flow of blood. The magnetic fields have been shown to affect the polarization of the blood cells. If a blood cell is completely round, you can't tell whether it's lining up in the magnetic field north-south, north-south. But by taking the blood of people suffering from thalassemia, which is a type of anemia, you get sickle cells, which means the cells are pronated something like that. And when you put them in a magnetic field, they tend to line up north-south, 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 instead of being anywhere. And this has the effect of improving circulation in some of the blood vessels in the region of the knees and elbows and other places which are rheumatoid. Can you see now that there are wonderful fields ahead for investigation if you're interested in the subject? You could use the radionic instrument for other things. You could use it in flower remedies. You would only have to, I'm really not going to get sticks now, too much talk, but you would only have to set up a couple of the symptoms involved. Resentment, visualize the resentment, or we could work out the radionic rates for all these things eventually. It's no problem. We could sit down together and say, well, now let's discuss agrimony. What are the characteristics of agrimony? And we could all voice our opinions about it and create a nice little fuzz here on agrimony. And then the clinician could sit down and pick up all this fuzz and get the rate for agrimony, and so on. Or you could set up the symptoms that the patient was suffering from, and then just take the 39 remedies and dip them in the well until you got to sleep. So, my summary of the radionic instrument is, by all means, try it. Do understand that not every person can work it. If you have a very concrete mind, it's probable that you won't be able to work it. If you are a person that is hostile or resentful to the fact that it is a non-scientific thing, you may not be able to work it, and so on. You can get to one, on condition that none of you mess around by that. I mean, turn the instrument inside out. I shall leave this here and you can play with it. I would say that what you should really do is to form healing groups. I've always said this, is to form a healing group and gradually equip it. I think personally that magnetism is far more useful than radionics. On the other hand, a radionic instrument can be very helpful as well. What you need is a healing group that can take care of a patient. You must be very careful in America to observe the law there. You may not charge a patient anything for treatment. You must not prescribe anything for the patient. You must always ensure that the patient sees his medical doctor first. You must, for your own protection, say that you're conducting an experiment, and so on and so on. It's your country, you have to work it out. Any questions about the specimen? Of course, you can go into diet. You can set up the patient's symptoms and you can find out what the person's diet should be. What should he have for breakfast? Should it generally be fruit? Should it generally include protein? Protein without carbohydrate, because he's a hypoglycemic. The moment I thought of hypoglycemia and protein, I thought of a hypoglycemic and got a sick. All right? Of course, you have to change yourselves.
They seem to feel that we should have a very good knowledge of anatomy before.
I couldn't agree with them more.
Okay. In other words, because the book is so complete with the anatomical names and all of them in deep descriptions, that's still not adequate.
Gordon, would you bring me up one of the cyber books from your desk? I mean, the desk in the office, one of the anatomy books. I'll just show them something else. There's 2 anatomy books, 2 cyber books, and a Graaf anatomy. There are 2 ways of approaching the subject of anatomy. You either learn the anatomy, which means that as you're going through the parts and everything, you are visualizing them, and that's much the best way. Or all you can do is to use an instrument from what I call an established laboratory that has a system, and you immediately come under that system. Even if you don't know what the duodenum is, you will tend to get a stick there. But of course, if you have a wrong conception and you think the duodenum is the colon, then you're going to get all sorts of things. I always beg people, if you're really going to go into instrumentation in healing, that you must do some work. You really got to do it. But of course there are wonderful drawings today, and I'm just getting a book up now to show you how you can go over an anatomy book and overcome some of the problem that way. I don't know what to advise about it. I mean, Marjorie Delaware doesn't have an anatomical training, but she has had a lot of experience and has looked at anatomy books and so on. Yes.
Certainly, if we decided after we complete our degree in this, if we went to do an experiment for a master's in doctorate, could we get one of those for?
Yes. My advice would be that you should wait for an advanced course, which we could set up here eventually. I'm really not prepared to do it at the moment. An advanced course which you do some anatomy, and you would have to have some anatomical displays of rabbits' intestines and things like that, which you can get quite easily without killing the animal. Thank you. And do the thing properly. But we must be geared for it. If you're going to do a radionics course here, then you've got to get it all set up, and you've got to have 20 students.
Next week, maybe the week after.
Oh, let's get our bachelor's degrees going, and then we could say that for advanced courses we could do more practical things. Good heavens, look what we have done in this week. See, you can get wonderful drawings today, and even these are nothing compared to the cellophane things, where you've got layers and layers of pictures at different levels. Yes, but there is really no substitute for the actual anatomy course. If you can do an anatomy course, it's even much better. Technically speaking, it should be possible for you to plug a probe in there. I know this machine can't do it because one of the wires is missing, and Gordon was going to solder it on. You are receiving blood spots in the post and in the mail, and you may not get round to looking at them for 2 or 3 days. And when you do, you may get a whole heap of them on your desk, on your table, and then work through them. With magnetism, you are dealing with therapy instruments which must be applied when the patient presents himself. And for 5 years, we evolved a regimen to deal with just this sort of situation where a variety of patients present themselves for examination and treatment. We would have in an average clinic rheumatoid arthritis, those suffering from acne, from high blood pressure, from special conditions like diminished hearing and flushing and so on. And so we elaborated a method of handling this sort of clinic. And naturally the patient would have to have a proper interview, would have to be questioned, the history of his complaint, the symptoms, all recorded. But sometimes it was not possible to do that immediately. And so our first method of treatment was to set up what we called a systemic treatment. In orthodox medicine, we talk about systemic treatment, we talk about local treatment. If a person is an arthritic, then they need systemic treatment, which takes care of the whole body as it is affected in totality by the disease. And then you have local treatment, in which the wrist, if it is rheumatoid, is specifically treated, and you call that local treatment. So you would give local treatment and systemic treatment. And our systemic treatment evolved as the result of observing that a certain set of magnetic fields applied twice a week would produce all the signs of lessening of tension. It had a relaxing effect, and this lessening of tension was measured by the fact that blood pressure would drop when it was given, that there would be better sleep cycles, there would be better bowel movement, there would be a general relaxation, a hiring or raising of the time for clotting of the blood. All the things that point to anti-stress began to emerge from a particular treatment which we now call the systemic. And the systemic treatment is the application of 7 solenoids. Did you find an MT3 tape, Betty? Anywhere, or didn't you?
Yes, this one here.
All right. Let's take Belinda. Take the coat off, Belinda, and lie yourself on the table. You can this side. So, are these the functioning ones? No.
Another
Set
two.
them up for John. All right, set her up for the 7 years. That will be all right. So this would be the tape that we would use for the systemic treatment. It's called MT3. It lowers cholesterol, it moderates the blood pressure, it affects the clotting time, it increases hemoglobin, does many things like that, which generally speaking have a So you go to the machine and you put the appropriate tape on. Anybody can do that. And this is the systemic treatment that you give even before you've examined the patient. If you haven't even got time to examine the patient, or you don't even know what's wrong with him, the systemic treatment. Now you'll notice where Mrs. Mosley is going to place these. One in the hollow above the clavicle, just in there, where there's no bone, there's no muscle there, there's just a soft packing of fascia and fatty materials. And so 2 of them are placed just there. One of them is placed on the gallbladder, which is just here. And what you do if the patient is unsuitably dressed, by that I mean that they have slippery clothes on and things, and they're not in a gown, then you use this very good material, which is supplied by M. Is it M3 at Minneapolis? 3M. Yes. This is called micropore. And you can virtually anchor the solenoids quite easily anywhere on the body. That's all right. That's the gallbladder. 2 solenoids placed on each of the suprarenal glands, just there. They slide in quite nicely. We'll take those over from this side. And 2 more under the calves of the legs. And that would be a half an hour treatment twice a week. By about the day, the changes in the blood chemistry that we have just described begin to occur, which indicates, that's all right, which indicates that, let me just change it over, there we are, now take it. When is it? Natural fact, we haven't got the couch in the right position, but you can see now that from one machine it would be possible to put an extension box in, and as this treatment accounts for about 75% of the treatments, you could just put an extension box in here and you could then add a whole lot more solenoids and just bring your amplification up. Now, at the moment, Belinda is being treated with a systemic treatment, and it would be possible for you just to check here. We have other devices for doing this, but just shove that on there and you can feel. There's quite a magnetic field coming out there. And that's a set of mixed frequencies of 7 different sounds. Anything from 256, you can all check that if you like. Anything from 256 up to 800 cycles.
Is that 256 cycles per second?
Yes. It's middle C. Now, this would be the systemic treatment. But you can also add to it, when you know what condition you're treating, you can add to it variations of the theme. If Belinda was suffering from an arthritic knee or an arthritic wrist, you just put the solenoid for the wrist in position and add that to the treatment. bring up your volume so that you're allowing extra juice for this particular field. Yes, has she got a watch on?
Yeah.
Well, not all that powerful, they're very minimal fields.
The vibration is what is going through the box.
The vibration may have some effect. It's a magnetic field. Let's mix up vibration with magnetism.
But there is no magnetism in that wave.
Oh yes, there is. Come on, where's the magnet you've just been using?
Any field, any coil will have a magnetic field.
All right. So there is a magnetic field now going to the wrist.
In like multiple sclerosis, for
Now wait a minute, you're going too fast. Talk about specific condition.
Vibration. Ever so slight.
Well, if you can't feel it, that's you, not me.
Ever so slight.
So the next thing now is to be able to go even more specifically to a condition. And if, like Charles, there was another magnet. If, like Charles, there was a specific condition, especially where you get in arthritis, the distortion of the fingers, and certain joints that are extremely painful, you may then tape on a magnet onto the specific part. That's an ordinary fixed field, but putting it in there gives again the alternating field. So you're directing and concentrating the magnetic field to a specific joint. All right? So with this sort of thing in mind, you can then you have to remember that this whole subject of magnetism has been, I just wanted to show, got any more of the solenoids, the varieties of solenoids. We were able to use virtually, we were able to reach almost any part of the body with various devices such as these. You must remember that this work has not been in functioning for nearly 7 years. So we're in the process of putting our clinic together once again. This could be used as a vaginal solenoid and is very good for certain conditions like vaginitis, very good for retroversion of the uterus. Any magnetic fields which are applied intravaginally are very useful for tightening up ligaments in those areas. We have anal solenoids which can assist in slowly and progressively the breaking down of thrombosed areas, and whilst we have not had great healing success with hemorrhoids, we have found that a short period of application of solenoids, then followed by standard treatments other than magnetism, was very useful. It seemed as if the solenoids cleared away obstructions in the area which had initially produced the hemorrhoidal condition. So what you're seeing here is a variety of solenoids. Here is another solenoid that can be placed inside the mouth for treatment of the soft palate, for, of course it will have to be sterilized, for treatment of painful areas in the jaw, parotitis, where you've got inflammation of salivary glands, and so on. And there's hardly a part of the body that you can't reach. It is also one of the treatments to be able to place, another bar magnet if you want, the ability to place a bar magnet, sterilized, inside the external auditory meatus, so that you give it to the patient to do. Most patients are sensible and know how far they can push an object into the ear comfortably. And that's all that is done. It lies quite comfortably there. You can tuck it around with cotton wool. And inside a head field, we have over there, inside a head field, you can virtually reach almost any part of the outer areas of the skull, and also inside the skull itself. Obviously, if you place two magnetic fields with north poles pointing inwards, then they will tend to separate against each other and reach medium structures inside the skull. You can treat all sorts of conditions like flushing, people who are in menopausal times, flushing of the face. And we had a young man who had tremendous flushes at the age of 18 and 19, which were very embarrassing to him. And by placing bar magnets on the facial arteries and the external carotid arteries, and placing the head inside the large field box, we were able to reach those arteries and restore their tone to them, so that the flushing was eventually overcome. So this is how it is possible to vary your fields, that you can reach almost any part of the body, and at the same time you can vary the kind of fluctuation of the field. At the moment we have got 7 frequencies mixed together. It makes a crickling noise. I don't think we've got the suitable instrument to hear that now. But it would be possible for you to... No, that's the vibrator. It's the other instrument. All that you would hear would be which would be 7 mixed frequencies on the tape. Which is what is being treated now. You've certainly felt the vibration. We know that the field is hardly explored yet. We know that it would be possible to have a magnetic field. It would be possible to have a little color disc in there with a light switched on, and you would then be able to treat with color, sound and magnetism each part of the body. And by various instruments placed around the table, it would be possible to vary the frequency of the magnetic fields on the appropriate parts. Then that you could bring in your radionics and combine the two, locating the site of difficulties by going over the body with the stick mechanism, locating the site on the body for the symptom that is set up on the radionic instrument. You'll find the site of the difficulty. And by placing the appropriate frequency on the site, you would be able to treat it directly. And it wouldn't coincide necessarily with what you might expect from an orthodox point of view. For instance, treating the thyroid gland does not mean that you have to lay the solenoids on the thyroid gland. There are other parts of the body which vary from patient to patient. Treating your thyroid gland is slightly different from treating somebody else's. And when you go into refined techniques like that, then you do need your radionic instruments. And remember, of course, that the radionics and the magnetism are all part and parcel of the same sort of process. Now, when you come to surgical conditions, we found, can we have a look at those 2 tapes there? See them? Yeah. There is a tape that was specifically made for rheumatoid arthritis. We have the formula somewhere for it. Rheumatoid arthritis. This one was made specifically for lowering the white cell count of the blood, and it has its particular notes on it. When we come to surgical conditions, we found that there was a very fine medium that could be used. Before we do that, Becky, hand me that solenoid there behind you, that round one. This would be very appropriate for the thigh. We've got boxes and boxes of these things somewhere, but you could quite easily draw that right up to the thigh. and treat almost any, as I say, any part of the body. For disseminated sclerosis or multiple sclerosis, we found that the best treatment was to lie the patient on his belly and to apply the solenoids down the spine. The head solenoid certainly, but the individual solenoids could be placed every 2 inches down the spine, right down the sciatic nerve on both sides and both legs. Then you use an extension box, and you would have as many as 32 solenoids on the patient. It would be a 2-hour treatment. It would take you an hour to fit the patient, set him up, and to undo him. So it was a 2-hour thing, and in such instances you would find virtually this magnetic field would be over the whole person. The whole person would be enclosed in it. Again, we have some spectacular devices packed away somewhere which we don't use normally but is useful for demonstrations like this, in which you can just take the bulb, a little flashlight bulb, and hold it in the magnetic field and it'll go on, indicating that there definitely are force fields here at play, and they're not hocus pocus. Now, when you get to surgical conditions, we found that the best thing to do with surgical conditions was to use a material known as Eusol, a solution of lime. In fact, it derives from EUSOL, Edinburgh University solution of lime. And during the war, when there were terrible air raid wounds with limbs torn off and great areas of flesh exposed, Eusol was made by Edinburgh University as a solution which was put into, soaked up by cotton wool pads. You could lay the cotton wool soaked in Eusol on the wounds, and it would keep the wound clean and at least free from possible infection until it could be more adequately treated, perhaps 2 days later, getting the patient out of the chaos of a bombed house and then to a bombed hospital, and then from the bombed hospital to a proper casualty station, and then right out into the countryside where they were reception stations. So whilst all that was going on, and of course it was really before the period of penicillin. In fact, I think I was one of the first ever to be treated with penicillin. That's why I'm so friendly disposed towards it. I was very badly wounded in 1941 in the desert, and I was treated with penicillin, which had to be kept in a frigid air because it would go off if it wasn't. And so Eusol was used then. Now, Betty, could you find that kidney dish from next door? And, oh, here it is. Here, just give it a rinse out. We're not going to have to be sterile now. And there's 2 bottles, bottle A and bottle B, in the shelf next door. And there's some cotton wool somewhere in here. Somebody?
I put it on one side there, didn't realize I
Oh, I have the cotton wool. Now, we found, and I use Eusol just about all the time for a variety of factors in combination with magnetism. We found that if you soaked the cotton wool pad in Eusol, you could place it on a sudden wound. And we have even treated medical doctors who have picked up infections in hospitals which can't be eradicated, and the hospital is the worst place to treat any infection, as you all know, because of the variety of unusual organisms there. All right, let's just demonstrate this. The Eusol very quickly goes off unless it's kept separate. So you have Eusol A, which is chlorinated lime, mixed with equal volumes of solution B. So you would have an equal quantity of A, and the moment that you put, this is boric acid, That's the chlorinated lime, and the boric acid put with it produces a bleach-smelling material. That still brings back memories of the hospital to me. And that is excellent for the removal of dead tissue, any sort of dead tissue. But for magnetic purposes, it contains calcium ions, which are very, very faintly magnetic, very faintly magnetic. And so that appears to be the advantage of them, that you could, that you could obtain, as it were, a field which not only cleaned the wound, but which at the same time allowed the magnetic devices to work far more effectively. That's the only explanation I could say. And so if you had a particular wound, you would, as in the normal use of Usol, you would apply a soaking pad, and this could also be used very effectively for acne. Now, the acne that I have in mind is not just the acne that the schoolboy suffers from. I'm talking about the acne that is so bad that it produces a leathery skin, especially on some unfortunates on the back as well. You get patches of this acne on the back and on the face, and when you feel the skin, it's literally like leather. And if you apply the soaked pads of Usol with a magnetic field, then after about 3 or 4 treatments, the whole leatheriness disappears. The leatheriness disappears. It's as if the fibers there are not causing obstructions. The material of the pimples is very easily expressed. It's destroyed by the Usol. The dead tissue is removed by the Usol, which cleans it and at the same time disinfects it. And there is tremendous improvement. Now, to treat it for acne, we don't use any of these instruments. We would take one of these solenoids. Have you got one there? Ordinary Vena solenoid. Anyone will do one from over there, Susan. Oh, here's one, right. So here you have a Vena solenoid. It isn't properly covered. You would take a pad of the Usol, not too wet, and put it underneath the Vena solenoid, which is a very powerful field indeed. In fact, if you like to plug that in, better you can show them by comparison how different the fields are. And the child or the boy or whoever it is just lies there. You can tape it on, and he can do his own patches on his face. Wherever he has, especially the creases of the nose and so on, you can... Yes, that's all right. It's on now. You can feel the difference. There's a tremendous difference with it.
Oh, yeah.
Anybody want to feel? Well, I could feel that. Oh, there's a big feel there.
Oh, yeah. Yeah.
It's our name, Venus. V-E-N-U-S.
I can feel that. It's all right.
It's just the vibration.
But it's much stronger.
I can feel it.
And it's 50 cycles. It's 50 cycles, straight off the walls. And it's 240 volts. In America, you would have to step that up. There's about 10,000 turns of wire on that.
And that is plugged directly into the wall?
This is excellent, yes. This is excellent for any surgical condition where you're needing a good vibration and you're improving circulation.